Member for Miramichi.
Thank you, Mr. Speaker. It's a pleasure to stand in the House today to give my response to the budget. It's certainly been one of the craziest years that it has ever experienced. But we can all be very proud to live in such an amazing province where we come together and get through a time like this. I want to thank Dr. Russell and her staff at Public Health for their amazing work to help keep New Brunswickers safe. Also, the COVID Cabinet Committee that has all the leaders from all four parties of our legislature on board to make some decisions. We're unique to the country in this, and I think it's been doing a wonderful job so far. It's been a very trying time, and we're blessed to do so well in New Brunswick, because we really don't have to look very far to see the devastation of this disease. And while our numbers are declining, there are many whose numbers are still on the rise. Like in Ontario, they reported yesterday another 1,791 cases with another additional 18 deaths. And I believe this is the third straight day that the numbers were over 1,700s. So we're really blessed to see our numbers declining and us fare so well for the last year. I'd like to also offer my condolences to the families who have lost loved ones due to COVID-19, not just in New Brunswick, but all over the world. Our thoughts and our prayers were with you and your family and friends. I also want to thank the Health Department and Public Safety Department and to the COVID team. As local representatives, we have many people coming to us with questions, and with the rules and regulations often changing as much as they have as we learned about the disease, these departments made it a lot easier for us to get the answers to them in a very timely manner, and for that, we are truly grateful. Besides the direct effects of COVID-19 that it had on the people of New Brunswick, it also created much more devastation of ripple effects that can be felt and will be felt for a long time. Mental health, depression, drug addiction, they're all on the rise and definitely boosted since COVID started. Crystal meth is another pandemic, another plague that's sweeping across the province. What we've seen in the last 3 years with the growth of this addiction is shocking. I can see it here in Fredericton, and I can certainly see it home in Miramichi. I've met so many people that have gotten caught up in this drug and can't get away from it. It's so cheap and easy to get your hands on, and it's such poison that you're hooked only after a time or two using it. And there's certainly not enough that's being done to stop it. We've been talking about it for the last 3 years since I've been here and since we've all been here. We hear studies, we hear 2-year plans, 5-year plans, but we need something done now. We needed something done 3 years ago. The problem isn't going away, and it's growing rapidly. But yet here we are having the same conversations as we did since 2018. We've been working very hard to start up a long-term drug facility in Miramichi for the past 3 years. We still don't have it running, but people are reaching out knowing about the importance of it, knowing about the organization, knowing about the services they offer, but we're still looking to get it off the ground. It's non-profit and asks very little funding of the government, but it's long-term rehabilitation, and that's exactly what's needed for this crystal meth. The government came out with a 5-year plan to help fight addiction and mental health, but we can fight this, plus more, in just a few months with Harvest House. They've been in operation for over 30 years in other parts of the province, and they've helped so many individuals fighting addiction, fighting mental health illness, and they help get people back on the track and become more active and engaged individuals in our society. They have a team in Miramichi. They have a group wanting to volunteer. We have a foundation started where people are already donating. We have had meetings with other organizations and departments, all looking forward to working collaboratively to fight the battle. And they've even started holding Overcomers meeting, which are support groups set up for people with any addiction. And it's been quite successful. Sometimes 12, 15 people have been attending. So now we're just looking for a place to hold it. In just a few short years, we've seen a huge rise in homelessness and in drug use and in break-ins, and it's only getting worse. People need to feed their addiction. Miramichi, we have no shelter, we have no long-term addictions, and we're only getting more addicts and more homeless all the time. Thankfully, Miramichi Youth House announced recently it's currently working to open its doors to a new shelter for adults and will help with housing, which is fantastic news. And hopefully soon we will have a long-term treatment that will get addicts off the streets and help them get their lives back. Our hospitals have a rotating door of service. Addictions can only offer services for a few days, and it has a wait list to get in. There's also a wait list for long-term addiction centers. So people have to wait in line to get a bed in addictions. They're only there for a short time and they have to wait again to get a room in a long-term care facility, which you have to be clean to go. And then you end up on the streets again because they're not able to stay dry until they can get there, and then the process begins all over again. There are gaps that need to be closed, and we can't wait much longer to make this happen. People are frustrated and people are dying. People and organizations are really coming together, and they have been for the last few years, to fight this horrible addiction, and that's the only way that we're going to see some change and that people are finally going to see a real difference. Senior care is an issue that really hits home for me, and there are so many important improvements that can be made. We should be doing all we can to keep our seniors at home longer. Staying at home is what seniors want. Plus, it's less cost for the government to make that happen. Personal home care workers are nurses, housekeepers, cooks, companions, maids, chauffeurs, and more. Plus, they use their own vehicle. So I was very happy to see the increase in the budget of over $12 million for home support workers, community residence workers, special care home workers, and family support workers. And the hours of home care workers to seniors at home should be increased as well. I have families that have called that couldn't keep their parents at home any longer because they were only getting 5 hours of care a day, but they work 8 to 10-hour shifts. So wouldn't it be just cheaper if the government can pay a little extra for a few hours a day rather than move them into a nursing home? And I want to talk a little bit about the nursing homes. We recently had my husband's uncle Frank, who I looked after for a few years before we had to put him into a home. He went into the Mount a few months before it closed and then moved to Shanix when it opened in October. So I got to spend a lot of time at both homes. And a lot of the same staff had come from one home to the other. So, and we were very blessed to have the amazing staff that we've had to look after them. Putting a loved one in a home is a decision that certainly is an easy one, but when you know that there are people there that love them as much as you do, it certainly makes it a lot easier. Our seniors' homes are critically understaffed across the province, and this issue is only getting worse. Again, we talk about the changes that need to be done, but years pass and we're not any further ahead. The care seniors are receiving is not only inadequate, but in some cases it's downright shameful. The staff have been amazing. They're doing everything that they can in their power to provide care for the residents. But we've heard from many staff that they feel helpless and defeated, that they can't do what they should be doing. So when we talk about staffing, we know staffing is an issue across the province, but it's not only a shortage of workers, it's also a mismanagement of staffing as well. Nurses are retiring, and we're having a hard time to keep up to that, but staff in seniors' homes are also leaving because of working conditions. The staff need help. They are stretched to the absolute max, to the point of exhaustion, especially during the pandemic. Nursing homes rely a lot on family to help with feeding, spending time, walking them, and helping them. And the staff at nursing homes have gone above and beyond for these residents during this time. But with these restrictions, many seniors didn't even understand what was happening, and they felt abandoned by their families. The staff did an amazing job to connect residents with their loved ones online and by phone. And I know how hard it was for staff before the pandemic. I can't imagine what they've been going through this past year. More nursing care beds are promised in the budget, which is great news, but there's nothing said in the budget about an increase to hours of care. Another question is, where will these beds be going? Private, public, and what kind of care will they receive? The Auditor General has suggested that the government compare cost and quality of service between the profit and the traditional non-profit homes. And our party put a motion in last week urging social development and the government to compare not only cost but the quality of care they're receiving when a company runs a nursing home for profit. and I think it should be a priority of the government. There's been many issues concerned around it, and it should be looked into. Staff barely have time to do the basic care, like getting them dressed, bathed, fed, and get their meds. They've been crying for more hours of care for years. They deserve more, and so do the residents. Staff at one time could sit down with a resident and talk about the weather, or to do their nails, or even play a game of cards, something to keep their spirits up. And now the staff are stretched to the max. They have no time to even do what is needed, let alone do the extras. Residents don't want to ring the call bell. They feel they're being a burden on the staff, and I have recommended multiple times for government to do drop-ins unannounced so they can see firsthand of the staffing issues. The staff members are alone for a long period of times on a unit of 20 residents. I recently heard a story from a nursing home that a staff member had locked themselves in a closet because a patient with Alzheimer's was trying to attack them. How horrible and traumatic for this worker, and I don't imagine it was an isolated incident. This is something that I brought up many times in committees and in the past, that it's not safe for the resident or the staff. But in saying that, I have spoken to members from 3 different nursing homes, and I'm told that drop-ins are being done, and they have been done. And it's great, and I want to thank the Minister of Social Development and his staff and his department, because this gives a lot clearer picture of what's happening in the homes. When we talk about mental health, we talk about mental health in schools, bullying. I've been hearing from so many people, getting with stories lately of bullying. It doesn't seem that long ago that I was in school, and we did see bullying back then. I want to say it was been too long ago. But we had name calling, fights outside, teasing, things like that. But if you were in a fight, you were reprimanded for it, you were sent home, and you got in trouble for it by your parents. These days, it goes beyond that. The stories I've heard in the last few months is terrifying, really. Threats with knives, life threats, kids being scared to go to school, scared to go to drive to town by themselves. I mean, there wasn't many that ever liked to go to school back then. But when you're terrified to go because you're terrified for your safety, it's a whole other level of bullying. I have the utmost respect for teachers. I certainly wouldn't want to be one in this day and age. Teachers have lost all their authority. When we went to school, and I know many of my colleagues are the same, teachers were respected no matter if we thought they were right or wrong, but they were respected, and we were scared of our teachers. And as my dad has always told me, with fear comes respect. And there isn't any much of both, of either these days. Today we don't see that, fear or respect. When students can speak to their teacher the way we've heard them speak to them in our schools, there's something seriously wrong with not only our system, but our society. Students used to be afraid to get caught doing something they weren't supposed to be doing. Now they know there'll be nothing that can be done with them, neither by the teachers nor their parents. It's causing so many more problems with kids that we're raising today. And having a son that's graduating this year, I feel that pain and that anxiety for them. So imagine how they're being spoken to each other if they're speaking to their students, to their teachers this way as well. Not to mention social media and cell phones. Messages that students send each other is appalling. No wonder there's such a spike in mental health cases. Kids can't get away from these horrible messages. There's no safe place when a student has a phone in their hand 24 hours a day. Mental health is on the rise, and mental health with children is too. We don't have the resources we need to battle this, but we also have to find the source of why this shift and work towards fixing that as well. We need to help children before they suffer from the traumatic effects of bullying and harassment. We need to start getting to the roots of these issues, finding out what's happening in our schools, what's happening with our kids. And instead of just treating the broken system and treating the broken kids, we need to get to the root of the problem, and we need to find what's causing it. That's why, Mr. Speaker, I was very concerned when I heard about the closing of the Youth Wellness Unit at the Moncton City due to staffing issues. Again, we've had a staff shortage in our hospitals for years, But it's not just a shortage of people, it's also the management, as I said earlier. Jobs that were once full-time positions are now posted as part-time, which nobody's applying for, and they end up staying empty and eventually disappearing. Nurses and staff want full-time jobs. They need full-time jobs. So at a time when mental illness, it's on the rise, and we are needing more resources, especially for our kids, we're losing them. At a time we're striving to increase population, we're forcing people to move away. Affordable housing is another issue that has only gotten worse and is only getting worse. With the price of tax being more than any province, and the fact that New Brunswick is the only province that charges a double tax, why would anyone want to move here and build a business or even build affordable housing when they can go somewhere else in the province and do it for a lot less and make more money? And that's exactly what's happening. The province needs to remove the double tax, and we've been saying it for a long time. And they have to increase the wages for our highly skilled workers. Then it will give people a reason to bring their families and move to New Brunswick. We have said many times that small businesses are the heart of our economy, and yet we're letting small businesses suffer and losing many businesses. In Miramichi, we've seen a lot of loss in the last few years, from mills to small stores to small businesses. And now with the news in the last couple of months about FPL, and they're taking that from Miramichi as well. It's very concerning. Miramichi is the center of the province, so not only is the job loss a concern, but the amount of fires we have seen in the last summer, which we believe will be again this year, they were more easily accessed from Miramichi, and the response time because of this was a lot faster. So with another dry summer ahead, it's really concerning for a lot of people, including the people that work for FPL. We've been very fortunate in New Brunswick with the pandemic that we fared so well with all our cases, yet our businesses are still suffering. Staffing these businesses has been a real challenge. I've heard from business owners and managers that they can't get staff to come back to work while they're getting federal funding. This is a real concern because many businesses have to cut back their hours of business. So this really needs to be looked at. We've talked a lot about our rotational workers in the last couple of weeks, the last couple of months. Because of the lack of jobs in New Brunswick, so many highly skilled workers are forced out of the province and away from their families to try to earn a decent wage. And now they feel like they're being treated like criminals when they try to return to the province with harsh isolation restrictions that no other province has. They and their families are getting harassed by their neighbors and communities, and at a time when we need to come together for each other, we are at times pushing each other apart. Our healthcare system is in dire need. The staff at hospitals are suffering, and the morale, we are told, is at an all-time low. I'm pleased to hear the minister is touring the province and meeting with the public concerning healthcare, and I do hope that in these travels she also speaks to the frontline staff, the nurses, the clerks, the ones that live day to day, and they will be the ones to be able to tell you how it can be improved and what's wrong with the system. I've worked with the healthcare system for over 20 years, and I've seen big changes in many aspects. The morale is certainly a big one. And this past year has put even more strain on that. Our hospital staff, our doctors and nurses and frontline workers, our cleaning crew, all have to go into sanitizing the rooms when people leave, not knowing what contaminants are in there, especially during the pandemic. And all of our staff deserve so much appreciation and to be acknowledged as the heroes they are. They faced this thing right from the beginning, not having any idea what they were looking into. And they did it with pride, and they did it without hesitation, and they continue to do so. And we certainly commend them for this. We need competitive wages, not only entice people to move here, but also to keep the ones we have. Which brings me to language, another reason why people are leaving the province. With the review of the Language Act this year, I really hope it shines some light on the issue. Now, I'm sure they're going to try to twist it and turn it into an anti-French agenda, which it certainly is not. But it's beyond time to figure out what the issues are with our two-language system and fix them, because we can't keep going this way. Again, positions that were once unilingual all along, when an employee retires or changes in a position, these positions are now becoming bilingual positions. They often sit idle for a long time as well, and they go without being filled. or they're filled with somebody that's not as qualified for it. This is affecting our level of service, and it's also affecting our staff morale. People who have taken pride in their jobs, enjoy their work, and wish to advance have not been able to do so, leaving them feeling frustrated and undervalued. And the real kicker when this happens is oftentimes that when one is working on that position that was not good enough to be there but could work casual for many years, now have to train the ones that are taking their place. I've seen it many times, I've lived it a few times. And it's causing dire effects. We talk about systemic racism in our province, but a lot of it starts right here. Decisions we make and conversations we have or are afraid to have. We only have to look at the electoral map to see how that's worked in our province over the last 50 years. It's been blamed on our party, but you can see that that doesn't happen overnight or just since 2018. It's completely divided our province right across the middle, and it's very sad to see. And I sincerely hope that this will be a topic that can be addressed openly and fairly, politics aside, and it's not seen as one culture against the other, but as a way to improve our system for everyone. Mr. Speaker, we are seeing some beautiful days out there today in the last couple of weeks. And with the nice weather, we're seeing the snow is melting, and we're also seeing the remnants of the winter and the garbage in our ditches and the sides of our roads. Our environment is another big issue that we have to face. We have turned into a society of such waste. Nothing is made to last, and everything we built only lasts a short time, and it's just thrown out. We see more garbage, plastics in our waters, our rivers and streams. And we talk about climate change and the implementation of money from the new carbon tax. But I think some of the money should go toward helping clean up our forests and our rivers and our streams. We need to clean up our streets so the garbage and the pollution don't make it to the rivers and kill the wildlife. Fines should be bigger, and we need to set rules to cut back on this waste. So to conclude on my comments about the budget, there are a lot of things that in this budget that look promising. And we see some increases in places, which is good to see. But we learned before that where money is increased in one part, it is taken from another, which reminds me of last year when Ability New Brunswick was cut, and a dozen people went without much needed equipment. But many thanks to you, Mr. Speaker, when you were at DTI and the Minister of DTI, you helped put that money back in place, and these people got their independence back. So I guess the devil's in the details, and we will learn along the way. And as we get into the estimates and more into the budget. And I look forward to the continued discussion from my colleagues on the budget in this week ahead. Thank you, Mr. Speaker.